All new tonight at 5:30, doctors are trying to stop the meningitis outbreak here in Maryland tonight. ABC 2 News' Roosevelt Leftwich is live with us with how they're planning to do that. Rosie.
Well, Josie, what's been happening here is that people have been hearing about this meningitis thing, and they have been flooding emergency rooms to see if they have this disease. But the thing is that they're getting treatments that may add to their pain. Now, the numbers are frightening, and they're growing every day. 137 reported cases across 10 states. 12 deaths, including 1 in Maryland, and 9 people have been sickened in this state. But this is causing a lot of people to rush to emergency rooms when they don't have any symptoms of meningitis. At Upper Chesapeake Medical Center in Bel Air, more than 50 people have come into their emergency room after they received notice from one of 2 Bel Air centers that they may have received a tainted steroid shot in their spine. Doctors say they have performed an unprecedented 45 spinal taps over the past 5 days to test for the disease, and 43 were negative and only 2 required further testing but have not been confirmed for the disease. They say meningitis is serious, but there are symptoms, and many people who don't have symptoms may be caught up in the panic.
The best bet is for them to go to their personal physician, because their personal doctor, their primary doctor, understands their baseline pain and where they were before the shot. And if the doctor feels that they need a spinal tap, of course, then they can escalate, send the patient to the emergency room, and we take it over from there. But for a patient to just look at a news story and show up at the emergency room, I think it's really not the best utilization of resources.
Now, Dr. Jonas says that if meningitis is confirmed, it is treatable, but he says people with existing health problems such as diabetics or people that have cardiopulmonary diseases, well, if they receive those shots, they should see their doctors as soon as possible because of possible complications there. Kelly? Joseph?
Rosie, I'm actually hearing people with commercials on the radio, lawyers actually advertising if you think you're impacted by this. I'm sure that only adds to the panic.
Exactly. It adds to the panic, and the thing you have to understand with this is that there are symptoms to this disease. Like, for example, people may have received the shot say like back in July or something like that. It takes anywhere from a week to 4 weeks for this to incubate, although some cases, some doctors may disagree and say it could take an even longer period. But if you've gone 4 weeks and may not have shown any symptoms like this, there's a good chance you're okay. But call your primary physician first before rushing to an emergency room for a test that could cause you more pain.
Okay. Roosevelt Leftwich, thank you for that report.